Welcome back to part 2 in a 3-part series on stretching after breast cancer surgery and treatment. Women generally feel tension in one of 3 areas or all: the chest, underarm, and back of the shoulder. This video focuses on stretches related to the underarm area. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Let's first test the tension in your underarm area. You're going to lie on your back, holding a broomstick out in front of you, and it's resting on your thighs. With straight arms, raise the stick up towards an overhead position. Can you touch the stick to the floor while keeping your arms straight? If you found this position challenging or had pain or tightness while doing it, this video will help. What causes all this tension in the underarm area? Lymph node removal is one reason. With a lumpectomy or a mastectomy, you're typically getting a sentinel node biopsy, and so that's where a few lymph nodes are removed, and then it's in that underarm area. With a lumpectomy, there's usually a separate incision in the armpit area. For a mastectomy, you usually have one incision, and the lymph nodes are removed through that incision in the breast area. In either case, nothing happens in isolation in the body. So there's going to be a lot of activity in that whole armpit area during surgery, and other areas around it are going to tighten up as a result. Auxiliary cording. This is probably the thing that affected my range of motion the most after surgery and is really common after having lymph nodes removed. Radiation side effects. This also topped the list for me. The whole underarm area is generally part of the radiated field, and so there's a delayed effect of radiation where you can get almost like a shortening and contracture of the tissues in that area. If you're already noticing tension from cording, these radiation side effects can be additive to this. When can you start these stretches? At about 4 to 6 weeks after surgery. Check with your healthcare team on when it's right for you to begin. What equipment will you need for these stretches? A table and chair, and then some sort of bar or a movable object that you can hang onto, like a staircase railing. The first stretch is table sides out to the front. So you're going to set yourself up on a chair with your affected hand on a table in front of you. You want your hand oriented so your thumb is up and your pinky side is on the table. Keeping your arms straight, you want to lean forward and gently slide your hand out as far as you can. Once your shoulder is in that extended position, hold for about 5 to 10 seconds. You can return to the start position and then repeat about 10 repetitions. You can expect to feel the stretch in that armpit area. You may notice that tension is going down into the torso, or you may feel a pull going into the upper arm. All of that is normal. As this stretch gets easier, you can move your chair back so that you can push the range of motion of your shoulder a little bit more. This stretch will help moving your arm into that overhead position. So why does this matter? Well, this comes up in everyday movements, such as putting an item on a top shelf. If you're traveling, you're putting that luggage in that top bin compartment. And if you want to lift weights eventually overhead, you want to have full range of motion in that direction before you're adding weight. The second stretch is a lean back. You want to grab onto some sort of a movable object like a staircase railing, a doorknob, or you can even hold on to the counter right at the kitchen sink area. While keeping your arms straight, you're going to gradually lean your body back to feel a stretch in your armpit area or the underside of your arms. You can hold about a minute and do some deep belly breaths throughout so you can encourage your tissues to let go. Like that last stretch, you may also feel some tension go into that side torso area. The goal of this stretch is to eventually have your arms up by your ears. A variation on this stretch is doing it one arm at a time. So this may be easier if you're doing this holding onto something at home. Whether you're doing this stretch one arm or both arms at the same time, you can shift your body weight back and forth to address different lines of tension. Anytime you feel an area that's much tighter than another area, you can hold that stretch longer. If this stretch is feeling easier, you can hold on to something that's overhead and then sink your body weight down to feel a stretch in that same underarm area. If you found these stretches useful, help me reach more women going through this adventure by subscribing down below. This next video covers stretches to address pain and tension in the back of the shoulder area. See you there.